Closing the Gap, Biomechanics of Space Closure in Orthodontics. Welcome to today's lecture. In this session, we will examine one of the most critical phases in orthodontic treatment following extractions, space closure. Our focus will be on the biomechanical principles, Anchorage requirements, and clinical strategies that guide efficient and stable space closure. Part 1. The rationale for extractions and space closure. Extraction of teeth is a common approach in orthodontics, particularly when there is a discrepancy between tooth size and arch length, or when skeletal and soft tissue considerations demand it. Key factors that influence the decision for extraction include the severity of dental crowding, the patient's vertical growth pattern, any midline discrepancies, the incisor-lip relationship, and the anchorage requirements of the case. Once extractions are performed, the orthodontist must carefully plan how to close the spaces. This process can be accomplished through 1. Retraction of the anterior teeth, also known as maximum anchorage. 2. Protraction of the posterior teeth, or minimum anchorage. And 3. A balanced combination of both, referred to as moderate anchorage. Part 2. The concept of anchorage. Anchorage is a cornerstone of orthodontic biomechanics. According to Newton's third law, every action force is accompanied by an equal and opposite reaction. Therefore, when anterior teeth are retracted distally, the posterior teeth tend to move mesially. Maximum anchorage requires that most of the extraction space be closed by retracting the anterior teeth. This often necessitates auxiliary support such as headgear, transpalatal arches, or increasingly, temporary anchorage devices, also called microimplants. Moderate anchorage involves sharing the space closure equally between anterior retraction and posterior protraction. Minimum anchorage requires that most of the closure occurs through mesial movement of the posterior teeth. This strategy is less common but indicated in certain malocclusions. Part 3. Differential mechanics and force systems. To achieve controlled movement, orthodontists must manipulate the moment-to-force ratio, or MI-F ratio. A Loman-F ratio, such as 6:1, tends to produce controlled tipping of a tooth. A Hyman-F ratio, approaching 12:1, produces root movement, also known as translation. In maximum anchorage situations, the posterior teeth must resist mesial movement. This is accomplished by applying high moments to the posterior teeth while allowing the anterior teeth to move distally with controlled tipping. In contrast, minimum anchorage relies on the opposite relationship. These biomechanical principles highlight that anchorage is not simply a matter of counting roots. Instead, it is defined by the force system applied to the teeth. Part 4. Frictional and frictionless space closure. There are two broad biomechanical strategies for closing extraction spaces: frictional and frictionless mechanics. 1. Frictional mechanics. In this system, teeth slide along the arch wire, as in en masse retraction. While conceptually simple, friction between the arch wire, brackets, and ligatures reduces the effective force available for tooth movement. This is why anchorage reinforcement, often with headgear or elastics, is so critical in these cases. Canine distalization followed by incisor retraction is a classic example of a two-stage frictional approach. 2. Frictionless mechanics. Here, space closure is achieved using loops, such as T-loops or bull loops, incorporated into the arch wire. The spring properties of the loops determined by wire size, loop configuration, and interbracket distance generate force systems with predictable mis-F ratios. Frictionless mechanics, particularly in segmented arch techniques, allow the orthodontist to design differential moments with greater precision. Part 5. The role of temporary anchorage devices. The introduction of microimplants or temporary anchorage devices has dramatically advanced the control of space closure. By placing TADs strategically, orthodontists can achieve en masse anterior retraction with minimal reliance on patient compliance. A TAD placed approximately 8 to 10 millimeters from the arch wire in the medium region results in near translation of the anterior teeth. Placement in a lower region tends to produce clockwise rotation of the maxillary dentition, which is useful in correcting anterior open bite. Placement in a higher region produces intrusive forces, helping to manage deep bite cases. This versatility makes microimplants an indispensable tool in modern orthodontic biomechanics. Part 6. Clinical considerations and side effects. While biomechanics provides theoretical clarity, clinical application requires caution. Large differential moments can create vertical side effects, such as incisor intrusion or molar extrusion, which must be carefully managed. In high-angle patients, for example, unwanted vertical changes may exacerbate facial aesthetics. Auxiliary appliances, such as high-pull headgear, may therefore be necessary to counteract these effects. In summary, space closure following extraction is a delicate balance between biomechanics and clinical judgment. Successful treatment requires a clear understanding of anchorage, differential mechanics, and the careful choice between frictional and frictionless strategies. With the advent of temporary anchorage devices, orthodontists today have greater control and efficiency than ever before. Understanding these methods is key to appreciating the science and artistry behind creating beautiful, healthy smiles. Thanks for watching, and we hope this video has helped you better understand this vital aspect of orthodontic treatment. So, the next time you see a stunning smile, you'll know the incredible science and artistry that may have gone into creating it. If you're a student interested in dentistry or orthodontics, we hope this video has given you a glimpse into this exciting field. Don't forget to like, subscribe, and hit that notification bell for more educational content. And if you have any questions, drop them in the comments below. Thanks for watching.